The opposing team mentioned a lot of studies where among youth marijuana was very addictive, and that it would lead to use of other drugs such as cocaine and heroin and the such. However, we are not. What we are pushing for is marijuana use medically, such as that used here in California by Proposition 215, where it is used only for most things such as to relieve cancer, such as a study done by the Molecular Cancer Therapeutics that few side effects reported are related to psychoactivity. THC shows efficiency of treatment of metastatic breast cancer in humans. Basically, what it was that marijuana, medical marijuana, did relieve pain from cancer, and also it did achieve some same results as chemotherapy without as much harm from allowing the drugs to be injected in the body. And another thing that the opposing team mentioned, that marijuana would cause people to would lead to depression in people. But according to a study by the Journal of Neuroscience, that preclinical and clinical studies show that cannabis modulates mood and possesses antidepressant-like properties mediated by agnostic activity of cannabinoids and central CB receptors. Another case that I have would be in the case of JJ, where he had serious behavioral problems and even issues with wanting to kill his own mother for no reason. And in school, he would get in trouble many times for beating up other kids, and was actually kicked out of, I want to say, six preschools before the age of 5. And according to the Hastings Center report in September-October 2002, that after a variety of medications provided ineffective for treating the 7-year-old behavior problems, his mother decided to try treating him with medical marijuana under the supervision of a pediatrician. The results were promising, but court officials tried to take the boy into care when they heard that his mother has been allowing him to use medical marijuana. But after the case was reviewed, they actually found out that the boy had been on over 27 different medications between during his first 7 years of life, and none of the medications actually worked except for marijuana. Now going back to that smoking marijuana is harmful. I'm not saying that it isn't, but the FDA does only label marijuana as a Class 1 or Schedule 1 drug because of the smoking disadvantages, the harmful side effects. However, there are other methods for the intake of marijuana, such as baked in foods or consumed in liquids. And then other benefits for marijuana use would be in AIDS. Well, cancer and AIDS patients that relieves nausea, and as my partner said, also it would help for people who are anorexic and who have problems gaining weight, that marijuana does stimulate appetite. In patients such as those who have glaucoma, glaucoma is progressive disease of the eye that can lead to blindness. It results in buildup of pressure within the eye, and marijuana reduces the pressure within the eye, holding off some of the damage. This is according to the Lyndon Smith Library. The Lyndon Smith Library also reports that controlling muscle spasms, seizures, and chronic muscular pain. Marijuana is also used medically by patients with epilepsy, multiple sclerosis, arthritis, spinal cord injuries, and other conditions which are characterized by muscle spastic seizures and severe chronic pain. In California, a report done by the Journal of Drug Issues in 2004 by Shireen Katapush, that they found that while prescription perceptions of harm of marijuana use have decreased over time in California and states, marijuana and other drug use has remained stable. Due to support of the medical use and general legalization of marijuana has increased over time in other states, personal approval for recreational use has decreased and use has not changed. So in California, in spite of the fact that marijuana was made legal medically, studies have found that that widespread use has not increased, but rather decreased illegally and increased more for people who are ill. According to a blog on marijuana, the marijuana use by Richard Conwin of November 23, 2009. He reports that street dealers do not require identification, and most states say it's easier to get marijuana on the streets than it is to get alcohol from licensed stores. So by legalizing marijuana, it would be no different than for teens to actually get it off the streets, except for the fact that you would have to go through a doctor or physician in order to get it. Thank you.